put some structure around simulation in robotic surgery. And we're keen to start developing a whole program which brings you from the basic level to advanced proficiency. And this was all brought about by a very big investment by the college of $2.5 million to try and help get the robotic program off the ground. So the curriculum, which is just one component of our robotic training, but the robotic curriculum, which is about to launch in September, consists of 3 different modules, module 1, 2, and 3. And as you go through the modules, it increases the proficiency level for the participant. So module 1 is the foundation level. It involves pre-course work. We've designed a whole comprehensive library of videos with tips, tricks, introduction to the robots, port placement, emergency scenarios. We really developed a very comprehensive library where you can learn before you come on the day. This will bring along your foundational knowledge, which is the key here. So you just will leave that module knowing all there is to know about different styles of robotic platforms, modular versus console-based, and emergency scenarios and how to deal with that. How to be a good assistant, tips, tricks, mistakes that can be made, all of that kind of thing. Module 2 will start working more on the core technical skills. Again, there will be pre-course learning, but we start working into a hydrogel model, which practices various different techniques of handling the robot. And this will bring along your psychomotor skills and tissue handling. Again, we're ratcheting up the level each time. There will be tissue-based handling this day. So we use a chicken leg and bowel anastomosis, as well as the emergency scenario training. Now, each of these modules will have assessment built into them, and then you get a certificate at the end of the day of each of these. We've buddied up 10 hours of simulator work with each one of these modules because we want the participant to have 30 hours of simulator work by the end of the certificate. And to get certification for the curriculum, you'll need to submit evidence of 30 hours of simulator work, as well as participation in the 3 modules and having passed the modules because of the assessment component. Now, let's just go through each module in a little bit more detail. Module 1, the foundation level, you'll start the day by getting a full orientation of 3 different robotic platforms. We have the Hugo Medtronic robot, the Centaur robot by Cornerstone, and the CMOR Versius robot. They're all very different in their style and use, and you get the opportunity to walk through each one and see what they're like. We will go through how to dock, set them up, instrument exchange, all of these things, the stack and how it works. You'll go through a full session of how to be an assistant at the bedside, brought through the different instruments that are used, the way to pass them in and out safely. Again, a tips and tricks scenario, pitfalls, use of clip appliers, all of those kind of things. We developed a standalone port placement station with video teaching. So the video will go through our model as well as a model in a real patient from the hospital, and it will just explain how to place ports properly and safely, and it gives you the chance to rehearse that in this section. And we have a hands-on component to the course as well. So this is just really introducing you to the basics. It will be passing thread through a bit like the laparoscopic skills stations you might be used to in the college, but the thread, pick and place, all these different exercises on basic models. And that'll give you the chance to just get a feel for using the hand controls and the foot controls and passing things from hand to hand. As well as that, there will be the human factors component to the day. Now, module 2 is trying to bring your skill level up a little. And we use this hydrogel model. So there are loads of different exercises that we do on this, and we'll spend many hours working on this. There will be threading the ring, a bit like Beat the Buzzer, if you ever played that game. These sections here where you're passing the thread in and out of them on both sides, up and down, cutting out the circle, cutting out the star, horizontal and vertical suturing. There's a little mole hidden under the skin here that'll be cutting that open, finding it, cutting it, and then suturing it closed. And then we will just keep repeating these continuously during the day. So there's a lot of dexterity and handling of the robot required for that. It really brings on the skills when you practice this one, and it's a nice little model to use. Module 3 will be a bit more advanced. First of all, we'll use the chicken leg. Now, this is a great model. It's well validated. It's if you ever did a course in RCSI in Belgium, the Center for Robotic Training there, this is one of the things you will do. And the great thing about the chicken leg is you get to handle skin. You can suture it, cut it, burn it. The muscle on the leg, you get to dissect through the different layers of the muscle. There's always a nerve going down through the muscle. You have to find that and vessel loop that. So we'll get you to do that. We can do that repeatedly, and it gives you just that feel of handling tissue safely and what that feels like. The next part of the day will be bowel anastomosis. Forgive the AI image. I just don't have a good one right now. But the bowel will really you have to be able to handle bowel very delicately, and we'll do a hand-sewn anastomosis with the robot to close the bowel, and we do that repeatedly. And that is great training in terms of tissue handling, both with both hands. Now, I've talked about the emergency scenario. We've developed a lot of these videos to try and train you how to manage the emergency scenario, which is a rare event, obviously, but there's very little training on it. And we're keen to really bring people up to a level that they're confident on how to deal with an emergency. And it's nice to come away from the hospital and into a relaxed environment to go through this a few times. And I'll just show you elements of it. So we have clear language, closed loop communication, how to undock safely, what the people in the room do, how to communicate between surgeon and bedside assistant, and the things like removing the instruments in a speedy fashion, the ports, getting them out for CPR, and starting CPR. So that's one element of the day as well. With this one that we've developed is actually for module 1, which is a cardiac arrest scenario, but we're going to increase the intensity of these as you go through module 2 and 3 to mimic things like bleeding. And we have some fun elements to introduce into that situation. So hopefully by the 3rd module, you really have a good ability or confidence level to deal with an emergency, as well as the communication elements of an emergency and how to go about communicating in that situation. And things like closed loop communication, team-based training, situational awareness, crisis preparedness. These are all very important components of a good fundamental robotic training program. We've also built our own simulator logbook. For those of you that are familiar with the RCSI logbook that you use for operations, we've done the same thing in terms of measuring your sim hours. As we said earlier, you need 30 hours of simulator work to be able to complete to get the certificate of completion for the end. And when you do some work on your simulator, you log the hours and which platform you used. Now, if you've done prior simulator work, we have an area where you can upload evidence of that, and that can be verified by us to ensure that those hours have been completed. And we've done this because you may work in different hospitals, you may use different types of simulators. We don't care what simulator you use. We don't care what robot you've used. We care that you've done 30 hours. Now, it would be best if you went through a program from start to finish. That's where you personally will get the most out of the simulator work, because if you're still doing the fundamentals for 30 hours in different robots, it won't bring you on as well. But there's a kind of a real world practicality about having access to simulators and robots that we tried to get around by building this. I said earlier there will be assessment. We're building in assessments for each of the day. We plan on being able to ultimately be able to have a pass-fail in terms of competency level during the course. But we will have kind of some proficiency-based assessment from the very outset. When you submit the 3 certificates from each module and evidence of the 30 hours of simulator work, you'll be presented with a certificate of completion of the RCSI curriculum. Now, this is just the start. This may not apply to everybody here who's just wants to hear about Module 1, but I just want to let you know that we're building a whole raft of intermediate level skills as well as advanced, which we've already been delivering in terms of the specialty days, such as porcine cadaver work, high fidelity tissue models, high fidelity hydrogel models. And we will start going into master classes for different specialties like a hernia, potentially human cadaver, and expert-led courses in the very near future. We've partnered with RC Academy in Belgium, and we will start delivering some of the courses that they deliver there. That will happen sometime next year, and we hope to build from there, where we're delivering similar courses for each other. And we're building in scholarships. So we've been granted funding from Cornerstone, the Centaur robot that we have here in the college. And we'll probably be linking these to quality improvement projects within robotic surgery in your hospital. So some evidence of an audit or quality improvement project around robotic surgery, such as efficiency, safety, governance, that kind of a thing. And we'll link that to a application process to allow people potentially go on robotic courses, or to potentially a robotic meeting, or to go visit a visiting site to another specialist center to see what they're doing there in terms of robotic surgery. So that's more or less it. You can see we've built a very comprehensive approach to the training. We're just at the stage where we're developing the foundational level, and we're going to keep working on that. We're starting in September with the launch, and that's Module 1. Module 2 and 3 still have to be built, but we expect them to be done for early next year, and we'll start rolling out the other modules as well. And that's it. Thank you.